Omicron has been labeled a variant of concern due to its high transmissibility and number of mutations. Experts say that low vaccination rates can lead to increased spread of the virus and further mutations. Getting the whole world vaccinated and boosted is imperative to help stop the spread of COVID-19 and prevent future worrisome variants from emerging. As cases of the Omicron continue to crop up all over the world, researchers are racing to better understand the variant and its potential impact on the global COVID-19 pandemic. New research from the CDC finds that a COVID-19 booster vaccine dose is extremely protective against getting very ill with the Omicron variant. People who'd received a COVID-19 booster dose were far less likely to end up in the emergency department or hospitalized. Another study found that people, especially older adults who've received a booster, are better protected against infection and death compared to the unvaccinated. The Centers for Disease Control and Prevention has published new research that found a third COVID-19 vaccine dose or booster provides tremendous protection against getting seriously ill with the Omicron variant of the coronavirus. These reports add more evidence to the importance of being up to date with COVID vaccinations. That means getting your primary series and getting boosted when eligible to protect against severe COVID-19. People who received a third COVID-19 vaccine dose were 82% less likely to end up at an emergency department or urgent care clinic during the Omicron wave compared to the unvaccinated. They were also 90% less likely to be hospitalized than were the unvaccinated. Both types of protection were lower during the Omicron wave compared to the Delta wave. During the Delta wave, protection against infection and death was higher among people who'd received a booster dose compared with those who were fully vaccinated but not boosted. Protection against infection was also higher for boosted people during the Omicron wave. The largest protection occurred for people over age 65, followed by those 50 to 64 years old. Some studies clearly show that those who were unvaccinated had much higher rates of infection and death. In fact, unvaccinated people in the study had an almost 20 times higher risk of dying from COVID-19 than the fully vaccinated. Researchers found that 3 doses provided more protection against symptomatic infection compared with 2 doses or being unvaccinated. Full vaccination and boosters provided less protection against the Omicron variant compared to Delta. Laboratory studies have found that Omicron is partially able to overcome the protection offered by the vaccines and prior immunity. The Center for Disease Control now recommends booster doses for everyone from 12 years and older, at least 5 months after the primary series of the Pfizer-BioNTech or Moderna vaccines, or at least 2 months after a single dose of the Johnson & Johnson vaccine. As the importance of boosters becomes clearer, the agency has shifted from encouraging people to be fully vaccinated to asking them to be up to date on their doses. These current vaccines will largely protect a completely vaccinated person from severe disease, hospitalizations, and death, which makes a good reliable vaccine. However, more research is needed to determine how well vaccines will be in preventing symptomatic or asymptomatic COVID-19. That concludes our video for the importance of COVID-19 booster for the protection against hospitalization during Omicron surge. If you enjoy watching this video, don't forget to click the like button, share to your friends, and subscribe to Earlyseven YouTube channel for more rad-clusive videos.